Let's go through Kohler disease, an important pediatric condition involving the navicular bone. We'll cover the pathophysiology, clinical features, imaging findings and management. Kohler disease is an avascular necrosis of the navicular bone in children. The exact cause is not known, but we understand the anatomy and biomechanics to explain why the navicular is vulnerable. It's the last tarsal bone to ossify, typically around age 3 to 5, and the central third is a watershed zone with relatively poor vascularity and an increased susceptibility to avascular necrosis. The navicular is wedged between the talus posteriorly and the cuneiforms anteriorly, with this repetitive loading during early walking years potentially compromising its blood supply. It typically occurs during ages 3 to 7, and 80% of the time it affects boys. It's bilateral in 25%, and it often correlates with periods of increased activity, growth spurts, or early sports participation. Children present with pain over the dorsal and medial aspect of the midfoot, associated with a limp or antalgic gait. There is tenderness directly over the navicular, and swelling is usually mild or absent. Parents may describe the child limping by the end of the day or avoiding running and jumping. The diagnosis is made on X-rays, with the classic radiographic findings being sclerosis, fragmentation, and flattening or collapse of the navicular. MRI is not required but will show edema and AVN changes if performed. The differentials include a navicular stress fracture, an infection such as osteomyelitis, or symptoms of an accessory navicular, a tarsal coalition, which usually affect older kids, and also juvenile idiopathic arthritis. The management is non-operative and is focused on symptomatic relief. This includes non-steroidal anti-inflammatories for pain relief, activity modification, avoiding running, jumping, or impact sports, a short period of immobilization in a cam boot or a walking cast, typically 4 to 6 weeks, and importantly, reassurance, emphasizing that this is a self-limiting condition. Symptoms can take 1 to 3 years to resolve, and the X-rays may also show recovery over 6 months to up to 4 years, with long-term outcomes being a normal recovery. So in summary, Kohler disease is an AVN of the navicular that has a predisposition for boys around the ages of 3 to 7, with X-rays showing fragmentation, sclerosis, and a flattening of the navicular. Treatment is symptomatic with rest, NSAIDs, and immobilization, and this is a self-limiting condition. Thank you for listening. That's another step towards acing ortho.